If you've been diagnosed with obstructive sleep apnea, probably many of the questions that you have are, what are my options? If you have obstructive sleep apnea, the number one thing that you need to be concerned about is it does need to be treated. For example, patients that have sleep disorder breathing or obstructive sleep apnea can have things like tachycardia, hypertension, they can have diabetes, increased weight gain, a number of factors, and it's because the sympathetic nervous system is having to take over in the middle of the night to keep you breathing. The two main treatments that we see that are non-surgical, and these are palliative treatments, these are treatments like taking a drug every day, is CPAP, continuous positive pressure, and this is the machines that people wear at night. And this is the most common treatment around the world for treating obstructive sleep apnea. It actually blows oxygen and air past the obstruction and helps and assists the body in getting more airflow during sleep. Occasionally, we can also do mandibular repositioning devices. If the obstruction is really the tongue or the lower jaw, then we can use anterior repositioning devices that are little appliances that we place into the jaws to help move the lower jaw forward, which consequently moves the tongue forward. These work sometimes, and it's very important that when you have one of these oral appliances, that it's monitored or titrated so that we know whether it's effective. Just because you have obstructive sleep apnea, whether you use CPAP or an oral appliance, you've got to make sure that it's actually working. Those are the two main treatments for, most common treatments I would say, for obstructive sleep apnea. However, neither one of these are a cure. So one of the things that we do at PreciDent is we also look at the cause of the obstruction. If the cause of the obstruction is primarily lack of growth of the lower jaw and upper jaw, then there is a surgery called MMA, Maxillomandibular advancement, and basically it's a surgery to help grow the jaw forward, which moves the palate and the tongue forward and opens the airway. And this gives you the ability to get the airflow through and down into your lungs properly so that you do not have the obstruction. If you have a narrow nose or a deviated nasal septum, then some nasal procedures can also be done to help open that nasal passage to help with the obstruction as well. The surgery MMA has shown very good results, and it's the only potential cure for obstructive sleep apnea because the problem is the lack of growth of the upper jaw and lower jaw. While surgery has not been the main treatment modality recommended in the past, today we're seeing more and more physicians and patients choose to go with the surgical option so that they don't have to worry about wearing the CPAP or the appliance, and it gives them more sense of security by opening the airway in a more permanent fashion.